It's really great to be here to speak to you all today about creating an economy and society of care. So, before going further, I'd like to note that a lot of what I'll be talking about today is on the website feministrecovery.ca as part of the Feminist Economic Recovery Plan that my institute, the Institute for Gender and the Economy, created in partnership with YWCA Canada. So, if you're interested in learning more about that, please head on over to that link. So, one of the pillars of the Feminist Economic Recovery Plan that we created was really centered on ensuring that care work is valued and recognized. And one of the things that's really come to the fore during the pandemic is how much care work is essential work. And that's really become very certain over the course of the past year and a half. So, whether we're talking about healthcare, childcare, elder care, or any other forms of care, it's really clear how necessary that work is. But the following characteristics of care have also really become obvious during the pandemic, and this is what I'll go a little bit more into during this talk. So care is very obviously highly gendered and racialized, with women doing much more unpaid care work than men. And they also tend to do the majority of the paid care work in the country as well, with paid care workers tending to be disproportionately women, racialized people, and or immigrants as well. So we also have to consider how care work is undervalued, with many paid care jobs being paid relatively low amounts compared to jobs in other sectors, and also having very few protections like paid sick leave. And as well, care work, at least until the pandemic, has often been very invisible. So it tends to be done within the home, which means that it is it seems to be a domain that's private, not a public good. And so the amount of work and skill that goes into caring is often highly underestimated. And it's seen as a responsibility for women and mothers that's supposed to be fulfilling for its own sake. And for many people, this work indeed is really fulfilling, but we also have to understand how the value and necessity of this work in our society tends to go unrecognized. So, you may have seen many headlines in the media about how the closures of schools and daycares have meant that parents, especially, have had to take on very heavy domestic and care burdens, or you may have experienced this difficult situation yourself during the pandemic. And it tends to be women who have always and continue to do more of this work than men. And during the pandemic, their hours per week spent on childcare went from 68 hours to 95 hours. And for fathers, their care hours also increased, but from 33 to 46 hours. So, as a result of this difficult situation, we saw many cases where women, many of whom were making lower salaries than their men partners, or who were in industries that were really heavily hit by the pandemic, like food services or retail, were reduced their work hours or left the workforce to accommodate this new situation. And last summer, we saw women's participation in the labor force actually fall to the levels that it was in the 1980s. And as well, we also saw racialized and low wage women, particularly facing relatively higher unemployment rates and more difficulties being able to look for paid work due to these care burdens. So, of course, eventually we saw the reopening of schools and daycares. But what's important to note is that for many families, returning to childcare was just not an option. For one, it can be extremely expensive, and hopefully this will change with new federal plans for $10 a day childcare. But in 2020, the monthly median daycare fees in preschool per child was $1,250. And during the pandemic, or you'll see that the other cities across the country also had fees that were in that range. So during the pandemic, Quebec, which is the only province with a publicly funded childcare policy, was the only place where we were seeing that families began returning to childcare at levels that were on par with what occurred prior to the pandemic. And so in other areas across the country, this meant closures of care services, even fewer childcare spaces than before, and essentially a lack of support to keep women in the workforce, because these fees were so high that for many people it was simply not possible to return to childcare. And then if we look at the paid care sector, or the supply side of things, we also have to consider how workers have been affected by the pandemic. I've already mentioned that salaries in this sector tend to be very low. Salaries of childcare workers, for instance, in 2015, they averaged a little over 24K, which is much lower than the average of all other workers. And they did not have access to protections like paid sick leave or other benefits, even though they are the workers who are helping to raise and develop our future generations. And we also saw that care workers in the health sector, which includes those in long-term care and community care, actually represented 20% of all COVID-19 infections in Canada. And this is double the global healthcare infection rate. So again, we saw many workers having to work in multiple jobs and in different locations, and they didn't have access to they didn't have economic security or access to paid sick leave. So it was necessary to work in those multiple jobs, and that in turn could have contributed to the spread of COVID. And we also have to consider that visible minorities and racialized folks are disproportionately represented in such care work roles. For example, representing 33% of nurse aides, orderlies, and patient service associates, and 40% of personal support workers. So it really came as no surprise that we were seeing COVID at 2 times higher rates in neighborhoods with a higher visible minority population. So it's really important to see how the vulnerabilities that were created among paid care workers really contributed to a vulnerability for our society as a whole. So the suggestion from me, as well as many others who are working in this sector on this field, is that we need to rethink how we value care and change our policies accordingly. So it's really become clear that the reality is that care is a universal need, and so everyone is involved in it. There's no one on earth who has not or will not need care at some point in their lives, and so hopefully this care is high quality and affordable and accessible. And we can also consider how care is infrastructure. So just like our roads and bridges, care centers and care workers structure our social relations and enable our economy to function. So we can really think of care as an underlying framework of our society, where it ensures that our children are educated and healthy, and it also ensures that our aging population and people with disabilities are living with dignity and respect. And the economist Armin Yalnizyan has stated throughout the pandemic that if our roads and bridges were collapsing, then we'd pay more attention to ensure that this infrastructure received investments. But social infrastructure that often helps the most marginalized people, as well as our whole economy, often does not receive the same attention. And the scholar Eva Kate has talked about how the resources devoted to care can really tell us a lot about how people in that society are faring. And finally, we can really think of care as an investment. So ensuring care workers and care infrastructure is strongly supported. It's been explored for decades by scholars now that this will lead to economic benefits. Care infrastructure is actually seen by many experts to be a linchpin for women's participation in the economy, and that means increased GDP. And there's also a lot of research around how care can provide significant returns to provincial and federal governments. First of all, through the increased tax revenues that come about from increased household spending. Second, from decreased demand for government programs and services due to that better labor market participation, as well as increased tax revenue over the long term from better labor market participation of children, because they benefit from early childhood education in their early years, and then that has payoffs when they're older. And in terms of the job market, more public support for care means that there will also be more jobs in the care sector overall, and that these can be good jobs. So the essential workers who are providing us with care will be better paid and protected, and will be incentivized to stay in these jobs in the long term, when currently it's very difficult to be able to do that. And these jobs are also green jobs. Researchers have explored how they don't contribute to carbon emissions like other industries do. So this is just one example of research that's been done on this issue, and this is a study from the UK Women's Budget Group. And this study estimated that job creation when investing 1% of the country's GDP in care versus in construction. So what the researchers found was that investing in the care economy generates almost 3 times more jobs compared to investing the equivalent in construction. And you can see that in the middle 2 columns of the graph that I have here on the slide. And it particularly creates more jobs for women, but also it creates more jobs for men. And this sort of estimate held even when they did this analysis with improved wage levels for care workers. So some of these jobs actually come from sectors outside of the target industry. So there are, of course, different sectors and suppliers involved in care if those jobs were to be created, from food services to education to manufacturing. And overall, the researchers of this study also found that a 1% investment would increase the overall employment rate in the country by 5%, and would also decrease the gender employment gap between men and women by 4%. So, just in closing here, when we talk about economic recovery, I think it's really important to look beyond measures such as GDP, because this is, I think, really a time where social policy can serve to make things better for all of us and our economic recovery, and where we really have the opportunity to center care and community within our policies. So instead of simply just focusing on GDP growth, we also need to understand and measure how we are valuing essential care work, both paid and unpaid, whether people have access to decent and sustainable jobs that have protections and benefits, how the poverty rates or rates of economic insecurity across the country are looking, and more measures like this. And paying attention to these factors will mean that we're paying attention to how our economy is working for everyone, and will potentially mean a stronger foundation for our society if and when crises like the COVID-19 pandemic happen again. So, as I said, if you're interested in learning more about anything I touched on today, I definitely encourage you to visit feministrecovery.ca, where the Feminist Economic Recovery Plan can be found, or my organization's website at gendereconomy.org. But other than that, thank you so much for your time and attention.